Hey, what's up? Barnaby here. We're talking in this HelloLife moment about anxiety disorders and the treatments that are available, because these are the things you've been writing into the website about, and we field them to Dr. Jeffrey Chamberlain, who is a family medicine specialist. So anxiety disorders, pretty prevalent?
There's a lot of anxiety disorders. It's one of the most common things I see in my office.
And you know what? Everybody, when they go to the doctor, they just want something to make it go away. Is it possible to make it go away?
People can work on their anxiety. It can get better, and some people it can go away. But there's no magic pill that's going to instantly make everything better. And so treating anxiety disorders, we have to hit it from a bunch of different angles. You know, there are a place for medications, but there's also a lot of other things we need to do. We need to figure out what's causing the anxiety. Are there certain triggers that we can avoid those triggers? Are there things in general that are just causing stress in your life that you might have to let go of, like even reading the news or watching the news and just seeing horrible thing after horrible thing that's happening all over the world. That adds our base level of stress up, which makes anxiety worse. And so there's people who just say, hey, I have to let that go. Even though that might not be what I worry about, it increases our stress. So getting rid of stressors, talking to your physician if you want medications or there's natural products that people can use. I've written a recent blog that talks a lot about different natural products for anxiety, and so that would be a good thing to check out. Also, meditation techniques can really help with anxiety. And then also therapy with a psychologist or counselor and helping get to the root of things has really been shown to help out, and you can really make a difference by going to counseling.
Yeah, because I know some people that I can observe and say, you're wound way too tight, and I advise them to maybe slow down. No, I can't, because I have to have all these commitments. I say, well, maybe go see somebody. Maybe they could give you something for it, to maybe just kind of knock the edge off. And I think a lot of people are worried about just getting snowed, becoming different people because of the chemicals being pumped into their bodies. Is that a big fear?
It's a big fear for a lot of people, and I think it's a good thing to think about. You don't want to have a pill as the answer for everything, but sometimes it's needed. Sometimes people need something extra to help them just organize things enough to be able to work on the core issues and to bring things down. And there's people who don't need the medications for life, but need them for a time to help kind of reorganize things, like you said, and kind of de-stress in certain ways. And then once they're used to thinking in a good way, and not a stressful way, then it's a whole lot easier.
Yeah, boy, a tough hurdle to hop over, because a lot of people just think, I can handle it myself, but maybe they do need some help.
Yeah, it's something that it's definitely important to get some help.
Yeah, and you know what? You're here for a reason, right? Watching this video because you've got questions about anxiety disorders and the treatments and the effects. And so we've got so much more information right here at HelloLife.net, because we are, after all, a smart living network you can tap in with a click of a mouse.